HHS Idea Lab, creating a modern and effective government by equipping HHS employees and members of the public with methodologies, air cover, and pathways for innovation. 6 pathways for innovation: HHS Innovates, HHS Innovator in Residence, HHS Entrepreneurs, HHS Ignite, HHS Ventures, HHS Competes. HHS Entrepreneurs, pairing internal ideas with external expertise, looking for the best talent in the U.S. 6 all-new projects. We caught up with each internal entrepreneur to learn more about the project. Tell us about the Improving Beneficiary Access to Health Information project.
The intent of the project is to optimize Blue Button for Medicare beneficiaries. Blue Button is a fantastic tool that lets patients electronically download their healthcare data. CMS has been a pioneer in this effort for the past several years, but we have reached the stage where we need to re-examine our system and optimize certain aspects of it, such as automating downloads and generally making the user experience better.
What are you looking for in an external entrepreneur applicant?
We're looking for somebody really smart who can think outside the box, knows data, knows systems to help us navigate that process. I think a background in healthcare would be nice, but I don't think it's actually essential. I think knowledge of data and systems, how different data systems talk to each other, how data systems interface with the web, two-factor authentication, EIDM, identity management, and the like. I think the most important thing that I'm looking for in an entrepreneur is somebody with not only a high IQ, but somebody with a high EQ. CMS is a very interesting and unique organization where the staff face multiple different challenges. And while I'm really excited about the possibility of a HHS entrepreneur coming on board, it has to be somebody who will integrate effectively and sympathetically with a very overburdened and overworked staff. What we don't need is somebody to come in and start implying that people are stupid.
What will an external entrepreneur get out of this experience?
Well, I think you'd want to do it because regardless of the occasional challenges of working in the government, it is actually one of the few places where you can effectuate massive change and really impact people's lives. So if we do this project properly, we will have the potential to touch 35 million Medicare beneficiaries and their caregivers, help turn them into empowered patients, and ideally improve the quality of their lives. So I think it's a huge opportunity. It's not without its challenges, but it will be well worthwhile if we pull it off.
Apply now at hhs.gov/idealab/pathways/HHS-entrepreneurs/